In Austria, all adults will be vaccinated from February. At least that's the government's plan. It'll be the first European country to introduce a general vaccine mandate. Many other nations in the EU are also considering at least a partial mandate affecting medical and nursing staff. They'd join the likes of Italy, which has compelled those in nursing professions to get the jab since spring. Italy is also the home to the so-called Green Pass requirement. On public transport, at work or in a bar, Italians must be ready to identify themselves as vaccinated, recovered or tested. Since this rule has been in place, many more Italians have got the jab. I'm Daniel Winter and this is your COVID-19 special. Italy, the UK and now Germany, all requiring those in health professions to get vaccinated. Proponents say it's the only way to ensure patients are protected. Critics argue it's an infringement on an individual's rights and lays the ground for a general vaccine mandate. Meanwhile, there's concern about staff shortages if vaccine-skeptic care workers respond by quitting the profession. DW's Christina Küffner reports.
Matthias Bußmann has worked as a geriatric nurse for 12 years. He supports the German government's vaccine mandate for healthcare workers to keep the risk of infection as low as possible for everyone here.
Einfach die Sicherheit, dass
you feel safer knowing for certain that all of your colleagues, all the people who you work with, are vaccinated. It's nice not having any uncertainty on that front.
Dass man in der Hinsicht keine Unsicherheiten hat.
Though the exact number isn't known, there are still many in Germany's healthcare sector who aren't vaccinated. That's why Andrea Jäger is open to mandates. But she says they shouldn't be limited to healthcare workers. I'd like to see the government move swiftly to introduce a national vaccine mandate instead of starting with the sectors that are already in the limelight and under pressure. I don't like the message this sends or the pressure this puts on nurses. It's like telling some people you must get vaccinated while essentially letting everyone else take their sweet time, since they're not as likely to drive up infections. A nationwide mandate is under debate, but if passed, it wouldn't go into effect until next year. To protect the especially vulnerable, a partial vaccine mandate is being implemented for all nursing home staff, a move welcomed by many in the sector. You can't just single out any one group or industry because there's no way of knowing if they're the ones responsible. There are so many people involved in running a nursing home, from housekeeping to the janitor, from care attendants to those who work in administration and often enter patients' rooms. But some worry that the combination of COVID-19, staff shortages, and vaccine requirements are placing too big a burden on workers already stretched to their limits. Those who are still left to shoulder this undue burden are being put under even more pressure. And I worry that this could be the last straw, that they'll say, I can't do this anymore, I won't do this anymore, and quit.
Wollen wir mal eins zusammen singen?
Ja, können wir ja mal.
Nurse Matthias Bußmann thinks there's no way around a national vaccine mandate in order for Germany to reach its target.
Alles, was geht, würde ich sagen.
Vaccinate anyone and everyone as fast as humanly possible. Mandatory vaccines for targeted groups are on the way in Germany. The German parliament, the Bundestag, passed a bill making jabs compulsory for healthcare workers.
Walter Ricciardi is a professor of hygiene and public health and he joins us now. Walter, thank you very much for speaking with us. So is mandatory vaccination a good idea? After all, many countries already have a shortage of critical workers such as in healthcare, so it could cause problems in that area.
It depends on the situation. Of course, in times of a pandemic with an incredibly contagious respiratory virus can be a measure if you don't have an appropriate coverage and you are overwhelmed by the request to have access to hospitals and healthcare. And of course, in this situation, you can take the tough decision, the extreme decision to introduce mandatory vaccination. Of course, in ordinary time, that wouldn't be the case, but these are not ordinary times.
Yes, extraordinary times, you say, call for extraordinary measures. And critics say, though, that measures like these are an infringement on human rights. And so even if everyone got vaccinated, there'd still be restrictions and infections every time a new variant came along. What's your reply to those critics?
My reply is that we live in a pandemic, which is an incredible danger to all humanity. And if we don't vaccinate all the mankind in a shorter term, we will live this experience for years. And of course, health will suffer first, but economy will suffer second. So to get out from this situation, we have to vaccinate all over the world, not only in richest countries. And that's the only reply that I have. So when you introduce this kind of measures, you must have in mind that this is an incredible danger for all humankind.
We've seen in many countries, such as Austria recently, which has introduced a vaccine mandate, massive protests against these measures. What's the response been in Italy?
No, we have had not mandatory, but we have managed to persuade people actually with an incredible success because we have almost 90% of the vaccinable population that up to now is vaccinated. Of course, there is a resistance, but the noisy minority is not more than 2-3%. So have been some noisy protests, but they are decreasing now.
Okay, but they would argue that at the moment everyone can get the vaccine if they want. It's free. It's quite widely available in Europe. And so those people who don't, it's their personal responsibility if they're putting themselves at risk. Do you agree with that point? And if not, at what point do we simply have to accept an increased risk in society?
The problem is that, again, we are dealing with an incredibly contagious respiratory virus. So if you go into a place where you have infected people, particularly with this Omicron variant, you get infected. So it's not ordinary times where you can walk around and maybe have a vaccination for some disease that is not transmitted by a respiratory apparatus. So you have to have in mind that these are incredibly challenging times, and then again, special decisions you have to be taken.
And how do you think that Omicron is changing how we think about our reaction to the pandemic? Because it seems like it's an entire other level of the virus's spread, just as we were getting used to the Delta variant.
The Delta variant has already changed the game, but the Omicron is going to disrupt even more because it's incredibly quick to be infected and is incredibly quick to be contagious. So we have to understand that not only the vaccine, which persists as a fundamental prerequisite for fighting this battle, it's okay, but it's not enough. So we have to pair vaccination with our behavior, so universal masking, ventilation, hygiene. So these are all the measures that we have to adopt all together to fight the disease.
Okay, well, we're not very happy with the situation, but that's the way it is, it seems. The pandemic continues for now. Walter Ricciardi, thank you very much for giving us your expert insights on that.
You're welcome.
Now it's time for you to ask and for us to answer. Here's a viewer question for our science correspondent, Derek Williams.
How many ICU patients are unvaccinated?
It proves surprisingly tough to find really current hard data for this answer, especially from places like the US and Europe, where the pandemic landscape is really in flux at the moment. But there are plenty of anecdotal reports about who's being hospitalized. For example, the comments by a well-known Oxford expert a few weeks ago that COVID-19 in the UK is generally no longer a disease of the vaccinated because vaccines, he said, tend to limit its suffocating affliction. The latest government surveillance report there says that vaccines remain 90% effective against hospitalization, at least with Delta. Now, this is pre-Omicron. Other countries in Europe have reported higher or lower percentages of vaccinated ICU patients. But in general, the data fairly closely mirrors what's being reported by the CDC in the US. Its most recent calculations from 14 states at the end of October say that unvaccinated people over the age of 18, reflected by the blue line, that they were being hospitalized at rates around 8 times higher than vaccinated people, so the green line. But breaking down COVID-19 sufferers into percentages of vaccinated and unvaccinated patients in a country's intensive care wards can also distort conclusions about how likely it is that people from the two groups will end up there, especially when a large percentage of the population is vaccinated. To explain, let's look, for instance, at a theoretical society of 100 people where 90 are vaccinated and 10 aren't. 4 of the 100 end up in the hospital from COVID, 2 from each group. What's reported is that 50% of the patients ending up in ICUs are vaccinated, which is true. But some vital information is missing, which is that while 20% of the unvaccinated people are ending up in intensive care, only a little over 2% of the vaccinated are. A very different picture. This was just a theoretical example, but the principle is being exploited to say that vaccines don't protect you well from severe disease. And for the Delta variant, at least, that's not correct.
And finally, as the world struggles to stave off COVID cases in the human population, veterinarians and charities hope to keep animals safe too. Just take Chile's Buin Zoo in Santiago, where lions, tigers and even orangutans received vaccines this week. The zoo injected 10 of their most susceptible species using an experimental formula donated by Zoetis, a global animal health company. And that's it from the COVID-19 special. Thank you very much for watching.